Okay, well, welcome everybody. It's, nice to see you again, and a new face as well. Now, in this lecture, I want to focus specifically on public health interventions. And I want to consider the economic evaluation of public health interventions. These pictures, you might think, what has this got to do with public health? Well, there is a clue there, the commonality of the moustache. I don't know if Movember has become large in Japan, but in Europe and the United States, Movember, or Moustache November, has become quite a movement about raising awareness about prostate cancer in men. I suppose it's based on the idea that it's men who have moustaches, but I don't think facial hair is that discriminatory. Some women also can benefit. But anyway, the idea is that men who don't normally have a moustache in November should not shave. Now, Patu, you'll have to go the other direction and shave, perhaps, but those who don't usually have a grow moustache will stop shaving and grow a moustache. And within a week or two look quite ridiculous. But this is how it raises awareness, because all their colleagues see them, their friends see them, their family sees them, and the linkage is made. So that's why I've got this picture with all these moustaches. It is a public health intervention of sorts. That then got me to thinking, how on earth would we evaluate this campaign? How would we evaluate Movember? And that would be very difficult. And in a way, this is a characteristic of a lot of public health interventions. They are not straightforward to evaluate. And we can contrast that with things like a new drug. Now, there are challenges in evaluating a new drug. Definitely there are challenges. And we've seen some of these this week already. The challenge of extrapolating survival. The challenge of valuing time spent in different health states. But the challenges with public health are even greater. So, in outline, what I'm going to do is review some of these challenges. Challenges involved if you want to undertake an economic evaluation of a public health intervention. And then in the second half of the lecture, I want to consider the question, are public health interventions somehow different when it comes to the economic evaluation? Are they just the same as evaluating new drugs or something like that? Or are they significantly different? And if so, how are they different? And I'm going to focus particularly on immunization programs as a vehicle to try and understand the extent to which public health interventions might be different from other health technologies. So that's the territory we're going to cover. So, what might the challenges be? Well, I think the first observation to make is that public health interventions are often more complex interventions than, for example, a new drug. A new drug as an intervention tends to be fairly straightforward. All right, there's a decision about what dosage it's going to be at, what's the frequency of taking the drug. There's questions about how you monitor the response, but the intervention itself typically is a fairly simple one. This is not generally the case in public health. In public health, it's much more likely that the intervention will have different elements to it. It will be quite complex. And I'll look at some examples of this shortly. So for example, I'll look at a case of a mass media campaign to increase smoking cessation, to encourage people to give up smoking. And that will highlight how the intervention itself is not particularly straightforward. It's also the case that not only are the interventions themselves more complex, the outcomes that we anticipate are also more complex. Now, again, comparing with new drugs, with a new drug, we're anticipating some change in the patient's health, possibly improving survival, possibly improving health status, so putting the patient in a better health state. But that's usually it. It's a change in health. That's what we're looking for. Now, with public health interventions, there can be much wider range of effects that are of interest. So it's not just the interventions are more complex, it's the range of outcomes, what the interventions might achieve are more complex. And I've got an example coming up where we'll look at what might sound a strange public health intervention, but a change in street lighting. And maybe not the change you expect. You might anticipate the change might be to have more street lights. This particular intervention we'll look at was to have less street lighting. So we'll get to that in a minute. So that's the first point to make. Now, I'm not saying all public health interventions are more complex, but I'm saying there's a tendency for them to be more complex. I'm not saying that the outcomes are always more complex, but there's a tendency for the outcomes to be more complex. Second observation to make is with public health interventions, attribution is probably more of an issue. In other words, the extent to which we can say these effects we've observed are because of the intervention. They result from the intervention. We can attribute the effects to the intervention. That is harder to do quite often in the public health field. Again, if we compare it with drugs, it's actually relatively easy to attribute the effect to the drug. And that's because frequently we'll set up a randomized controlled trial in order to investigate how well the drug works. And we randomize half of our patients to taking the new drug and half to whatever's usual care. And because we've randomized, we can be fairly confident any difference we observe is because of, it is an effect of the new drug. It is attributable to the new drug. Now that sort of direct link is much harder to establish frequently with public health interventions, and we'll see that in a few examples. So that's so far increased complexity, increased challenge in establishing that what were the effects that were due to the intervention.